Hey everyone, thank you so much for being part of this very special episode with Dr. Dominic Vachon, a medical psychologist at the University of Notre Dame. I did want to alert you that the recording cuts off with only a couple of minutes left at the very end, a little bit of an abrupt ending, but nonetheless, we thought the content and the information was important enough to bring it to you in this format. So thank you for being with us for this episode. Hey everyone, welcome to this episode of Compassion and Courage, Conversations in Healthcare. This is the podcast where I teach compassionate communication, inspire resilience, and provide perspective. Thank you to everyone who has rated and reviewed and subscribed and shared the podcast. We very much appreciate your support. We very much appreciate all the comments and the likes and all of those good social media things. Today, I am so excited to share with you a friend, a colleague, a co-instructor, and this is a really wonderful opportunity because a lot of times when we talk about compassion, we think of it as a feeling. We think of it as something that we feel or a virtue, but we don't really get into the science, and that is what we're going to get to do to some today. And my guest today is Dr. Dominic Vachon. Welcome to the podcast, Dominic. Thank you so much for being with us.
Well, hi, Marcus. Thank you so much for inviting me.
So I am so excited to talk to you about not only the compassionate care and medicine minor at Notre Dame, but also to talk to you a little bit about your background and to bring us up to the current day. You're a medical psychologist. You are the director of the Ruth Hillebrand Center for Compassionate Care and Medicine at the University of Notre Dame in South Bend, Indiana. And to me, in addition to being a friend, you're kind of my boss and a co-instructor in the pathos. Yeah. I guess I need to kiss up a little bit since you're my boss.
Okay, all right. We were going to bump up your salary, and that's definite now.
Oh, yeah. And apparently, in the world of academia, I hear that salaries are on the rise.
Oh, I had not heard that.
You have not gotten that memo.
I'm sorry, was that misinformation?
Probably so. Yeah, it's probably a hacking campaign or misinformation campaign.
Well, that's good.
So Dominic, you're a medical psychologist, and I can imagine that as a child growing up, you didn't really know what a medical psychologist was. How did you end up in this field? How did you get interested in this? Can you take us back to kind of your early history and what set your feet on this path?
Wow, I have not thought about this. So I grew up in Fort Pierce, Florida, just 2 hours southeast of you. My parents have been citrus growers. They're retired now, and so I grew up raising oranges and grapefruit. I think early on I got gripped by what it means to be human, what it means to go through life. Think about it. I was always thinking about it, and especially when my brother got really sick with cancer, I became even more deeply engaged in thinking about what it means to be with other people who are going through suffering, accompanying people, and that just solidified that pathway. So I think I was always interested in personal growth and getting to know how we human beings tick. So I didn't know where that was going to fit. I was always interested in spirituality and psychology and philosophy, and I think I wove back and forth through those. But frankly, when I graduated from high school, I was interested in being a pilot. That was what I was going to do, and all of a sudden, senior year, realized that I was totally on the wrong path. So I was on a path of science and engineering, and even though I was really in thinking about life and what it means to be human and accompany other people, I was really on this science, I'm going to fly path. And then pretty dramatically, senior year high school, realized, oh my gosh, this is not who I am. I'm really I'm really called to do this other piece, which is what I'm doing now, but I wouldn't have known what to call it. So that's what I went to Notre Dame. I studied psychology and philosophy. Always wanted I wanted to be a psychologist, but I was also interested in spirituality. So I studied theology, spirituality at Notre Dame after I graduated. Then worked in healthcare for a while, and then really got clear of like I want to work with people who are going through things, and I want to help people who are the helpers, and that's how this work got started.
Thank you for sharing that. There's so many aspects that we could discuss. That you have such an interesting history, both academically and personally and professionally. Can we go back to that high school time that you talked about in the discernment process that you did not want to be a pilot and pursue aviation?
Yeah.
I've read your book, which I believe every clinician should read, called "How Doctors Care," even if you're not a doctor. When we talk about the title of the book is "How Doctors Care," 2020 from Cognella Press, correct?
Yes, thank you.
And the subtitle of the book is "The Science of Compassion." I'm mixing up the subtitle there, but
The
close to
science
that.
of compassionate care and the science of compassionate and balanced caring in medicine.
So people might not understand that compassion is truly a science, but it goes back to the humanity part and what you shared earlier about your brother getting
Yeah.
sick. And I know that you dedicated your book, which is kind of the sentinel
Well,
textbook now on compassion science, to your late brother. Could you tell us a little bit about him and how that came into your world and how that bled into
okay.
your professional career?
Yes, uh, my younger brother is 6 years younger than I am, and I was a senior at Notre Dame, and um, he was 14 years old, and he um, uh, we found that he had a brain tumor that paralyzed him, and had uh, emergency surgery to get it out, and then but then found out that it had metastasized to some extent. And so for 4 years, he went through surgery, radiation, chemo, remission. He had the type of cancer he had is a very dangerous type, and it came back, and so he died in 1983. And what happened in that, like I said, I was already engaged with, what does it mean to be human, and thinking about deeply about life and the journey. Um, but uh, Going through that with him, and encountering our own helplessness, so like watching what my mom and dad were going through, my sister, our friends and relatives, what I was going through, just like feeling so helpless as he was going through so much. And now this is more clear now, looking back at it, but I was really gripped by what we were all going through, and like we really wanted to be there with him, but also how helpless we felt all the way through. And then really noticing the healthcare people, noticing the nurses and the doctors and the spiritual care people, and some of them were really good and some of them were terrible. Some of us, sometimes they would relate to us and it just was like, oh my gosh, what do you think you're doing? And then others would be uh, very quickly connecting with us and becoming a huge support. And I became really gripped by the two sides of that. What do families go through when their loved one is suffering? And then the other side, what do healthcare people go through as their patients are going through suffering? And for a long time in my career, I kept both of those sides going. And I worked on both sides as a psychologist, doing therapy, as well as research on family caregiving and professional caregiving. And its roots were really with my brother, because going through that with him just made me very clear that that's what I was called to do, is to really help people who are helping other people. And I really had those parallel paths going for a long time.
And even now, the work that we're doing is even before people start helping people, right?
Yes.
Our students that are pre-med specifically we're trying to give them this foundation of what does it mean to be present and compassionate before they ever have any letters after their names, before they ever maybe even sit down with a clinician for the first time. So could you tell us a little bit about why things are so special at Notre Dame? Tell us a little bit about the Ruth Hillebrand Center for Compassionate Care and Medicine, and then and how rare this is. I've been fortunate to visit probably hundreds of universities around the country, and this is the only program that I have ever come across that is specifically focused on compassionate care and medicine. And I think that's so it's rare and it's beautiful. And can you give a little commentary on how this all came about?
Well, and thank you for saying that about Notre Dame, but just every place has a special magic, and the more I do this work and get to go to different places, I'm inspired by Gene Watson on this, that what we find is we have kindred spirits all over the world who are gripped by, gosh, we need to make the world a better place. Compassion is like the highest priority, and that's one of my favorite things to do, is to connect with people throughout the world, really, on that. I think at Notre Dame what has happened was that, first, our ethic is really like, how are we going to make the world a better place? And when people come here, whatever goal they have, a really heavy part of being here is, well, okay, you're a smart person, you're going to be doing this, but smart for what? What is it all for? How are you going to make the world a better place? Whether you're in business, whether you're studying history, or you're going to be a nurse, a doctor, whatever it is, how are you going to make the world a better place? And there's amazing synchronicity that happened. And Ruth Hillebrand, who donated the first money to start this center, her brother had gone here, and she had gone through this terrible, she was told her diagnosis over the phone when she was alone at home, and she was just like, I want to make healthcare better. And through her brother Joseph, gave half her estate to the University of Toledo Medical School and half to Notre Dame. And Notre Dame doesn't have a medical school. But so many people from Notre Dame go into medicine and go into nursing and teaching and other helping professions. The case was made, why don't we start earlier? Instead of thinking we're going to train these things later, why aren't we starting earlier? Because people are complaining that once they go to medical school or nursing school, once they get into residency, once they get into practice, they are overwhelmed with everything that they have to do. So with the wisdom of a lot of neat people at the time, Ruth Hillebrand, her brother Joseph, Father Jim Foster, Dean Crawford at the time, and many other people, John Hannon, the thinking was why don't we start earlier? Instead of thinking of the undergrad college years as getting ready to go to nursing school or med school or whatever, why not start now? And that's how it all began. And that's how you and I got to work together, was through one of those courses. So Yeah, thanks for asking about
Well,
that.
and the minor, the compassionate care and medicine minor. So our students typically are getting a major in usually something biologically related, neuroscience or biology, even chemistry. But they can get the minor in compassionate care and medicine. So, what kinds of things do pre-meds who are getting this minor? What kind of courses do they take that help them hopefully become those compassionate, present clinicians in their future professional life?
Okay. Well, we started in 2011, and when I came from doing residency training for new physicians, and um the approach that I use is using the science of compassion. People usually, like you said earlier, think of compassion as a warm, fuzzy thing, a soft thing, and it has those pieces to it. But there is this wonderful uh, new science of compassion, like biology and neuroscience and psychology of compassion, where we've realized that a lot of things that we're teaching about compassion are really not very helpful to people who do this work. It's sentimental, it's just plain wrong. And so what we did was we developed a menu of courses. The one that you help us teach called Introduction to Personalism in Medicine. We do another one called Compassionate Care in Medicine. That's where we teach the science, the neuroscience of compassion, and how it relates practically to being a clinician. We do another one called Medical Counseling Skills, and this one is pretty much like a medical or a nursing skills class where we use simulated patient actors, and we teach undergrads the things that medical and nursing schools are skipping over or don't have much time for. And then another course we do is spiritualities of caring in the helping professions. And this is where we invite clinicians and administrators from all different religious and spiritual backgrounds to talk about how do they rely on their spirituality or their philosophy of life to help them keep going. So anyway, we started doing these courses, and we thought with science majors they were only going to take one or two, and we have some other courses as well that we do. But we thought they'd take one or two, and that would be it. And then all of a sudden, this was about 4 or 5 years ago, students started complaining, and they'd be like, "Well, I'm taking all of these classes, and why can't we get a minor for this?" And we're like going, "You want a minor in compassionate care and medicine?" And then so it's the students who asked for it. And so we investigated it, and we thought, well, we can do this, a 15 credit minor, where people take the Science of Compassion core course. They do 2 electives on some aspect of Science of Compassion. They do an experiential course, and then they do a capstone project where they they research some area through the lens of the Science of Compassion. And so we started out, and we had a few students. We had 3 students graduate with it 4 years ago, and then it went to 30, over 30 a year. And right now we have 170 students who are minoring in compassion care and medicine. So it's taken off, but it's really the students who were like, "Please, I want more," and we're like going. They were prioritizing this. So it's been very exciting to be part of this.
It's exciting that to be part of this for me. It's also exciting that this just exists at all. Anytime I tell people about the Pathos Project course, Introduction and Personalism to Medicine, that I have the good fortune of co-instructing with you, whenever I tell them that it's about being with patients, being with family, training future docs to provide that therapeutic, compassionate presence, much like Jenny did for me in the emergency room, much like Barb did for me under her care. People say, It is so necessary. It's so necessary to do this kind of training in compassion and presence and medical counseling skills. And I feel in a way kind of sorry for doctors and providers,
Yeah.
because it seems like the public has, to a certain extent, lumped them into this category where they feel like doctors are not compassionate. They feel like docs are
Yes.
not present, and there's a laundry list of reasons why that may be, but that's what we're trying to
Yeah.
do in this course, in this work, is to found those skills and those mindsets early, to help create a an entire, we're going to base the entire American healthcare system on future docs.
Yeah.
So much of the healthcare system on future docs. I'm just so excited that even though that it doesn't seem like there are many programs like this around the country, they are starting to come along. People are starting to
Yeah.
see that this is not a quote unquote soft science, but this is real and necessary.
Yes. Yes. Uh, it I really, I mean, again, I think, you know, doctors and nurses and other clinicians are unhappy about the lack of compassion too. The patients and the loved ones are, but like everybody is like uh, uh, feeling this pinch, so to speak. That this kind of like, we get it. How are we losing the core of who we are in this? So everybody's complaining. Everybody's, and what we've really seen with science of compassion, and I say to people, if you think that compassion is a nice thing to add on to your practice, but it's not necessary, well, you need to know that you're practicing outdated medicine. Like what we know now scientifically, and there's like no doubt about this, compassion is absolutely essential for your patients, not only their satisfaction, but their actual medical outcomes are going to be better if you're coming from a compassionate core. But the other thing we found out is that compassion is absolutely essential to surviving and thriving as a clinician. So if you don't have compassion, you are a candidate for burnout, big time. It is going to be very hard to sustain this work if you aren't centered in that. And but what's tricky is you've got to be clear about what compassion is, not a sentimental understanding of it. And what you help us do is help us get that more clear sense of what does it mean to accompany people who are suffering, and to learn how to do that without like wanting to run away or get overwhelmed. And in the course that you help us with, and you know, when I met you, you know, it's kind of like, oh my gosh, that's why we invited you, because you can really tell people what it's like going through, you know, what, 350 hours of surgery and all the things that you had to go through. You help our students really kind of hear, like, here's what it's like, and here's the difference it makes, whether you're a nurse, a doctor, family member, the willingness to hang in there and not run away or not get overwhelmed. Oh my gosh, you know, that makes everything work better.
So we're
Um,
teaching resiliency at the same time we're teaching compassion, and they're
yeah, yeah,
kind of two sides of a similar coin.
yeah, that's a good point. And as you say that, uh, you know, I guess I'm going back to the earlier themes with my brother and like the family side, the patient side, and the clinicians. Um, but that all those like your resiliency, Marcus. You know, like, you know what you had to do to keep going. You know what your parents, your loved ones had to go through, and then the people who accompanied you. You know, like the nurses and the therapists and the physicians. You know, that all of us had to be resilient in that. You know, it wasn't like I mean, I guess I'm just reflecting on how you teach us all the time. You know that you certainly do this now, but I'm imagining people who were accompanying you then were like, they were like going probably overwhelmed, but then you probably inspired them, helped them, because it was what we've seen in the mystery of caring for people who are suffering is that it's a very, very mutual process. So it's not a one-way street, so I think your resilience probably inspired them to be resilient, because it was very much a relationship. It's not just I help you and it's a one-sided thing. It's I help you and you're teaching me as I'm helping you. And that's the mystery when you help teach our students. That's the mystery we want to invite them into. And that when you accompany people who are suffering, the sentimental understanding would be like, oh, you're gonna run out of energy, you're gonna run out of compassion. But what happens instead is we're accompanying each other, and there's this other energy that starts coming up where you're like going, oh my gosh, I wouldn't want to be anywhere else but with you. And I guess that's the definition of resilience, where you just bounce back because we find this energy to be with each other.
And you say we bounce back, and I think one of the things that I've so taken from your teachings whenever I've sat in on other classes that you're instructing is the idea of leaning in. And there's so often clinicians, especially when they're first getting into healthcare and medicine, think, I guess it's the overall thinking of, well, if you start feeling compassion fatigue and burnout and such like that, you need to get away. You need to get away from the work. You need to take a break.
Yes.
You need a vacation. You need to step away. But that's not as much what we found to be the most beneficial. What we found is leaning in and letting oneself feel that compassion and all the heartache that goes along with this very sacred work of taking care of patients. I'm wondering if you can comment a little bit on how clinicians can lean into compassion when they might be feeling exhaustion, overwhelm, burnout.
Yeah. Wow, that's a core question. I mean, if I start with the other side, so like what happens and I know this personally because 29 years ago, I came home and I said to my wife, and this is after me studying empathy and burnout with nurses, and I'm doing all this stuff, and I come home and I say to my wife, like 4 or 5 years later, I hate my patients. And so I had gotten burnt out. I didn't have that right balance in being compassionate. But just to start with the extremes, what I can tell you, both from my own life and being with other people, is that when you detach, you think that detaching makes sense. It looks like it's going to help. Like I'm going to keep helping other people, but I'm going to detach as I'm doing that. And what you find when you do that is it gets worse. You actually burn out faster. You actually can't hang in, and you get to the point that I did where I'm like having to push myself to keep working with people. And privately, I was like, I hate my patients. It was a terrible place. And then the other side of that, the other extreme, is the person you're working with, or all the people you're working with who are suffering, it piles on, and you get kind of like drowning in it. And so that's the other extreme. And that's what we call technically empathic distress. This is where you are accompanying other people, but you feel their pain as if it were your own. And so this compassion is that sweet spot. And so when you lean into it, it's leaning in and kind of walking a balance at the same time, because the extremes don't work. And believe me, I've tried both. I've gotten over-involved and overwhelmed. That doesn't work in the long run. And I've detached. And that doesn't work in the long run. So you find, like most things in life, it's a balance, and you hang in there, and you make mistakes, and you learn as you do this. So you're leaning in, but you find that when you accompany people, you actually can accompany people without getting swallowed up and without running away. And and it's a learning process. And this is what we're helping. You help our students do this. You bring them into this, but it's like anything else. You learn how to find that balance.
And finding that balance is one of the things that I think we helping students who will be future clinicians, finding that balance is one thing that I think that we do really well in the Pathos Project course is in addition to our students listening to my perspective as a patient and doing some narrative medicine reflections and writings, they're also getting exposure to 8 or 9 practicing physicians and hearing the stories from these different physicians who are in different medical specialties, hearing how they have also struggled with burnout, with compassion fatigue, with moral injury, and hearing those stories. Again, my storytelling background, we learn so much from stories. So can you tell us a little bit the story about when you became burned out? What did you personally do to come back? Because these days we have such a robust, and I say you have such a robust culture, I suppose, around medical education that we're you certainly don't seem burnt out. You certainly don't seem burnt out. You certainly seem like you've conquered what happens when you burnt out. So what did you personally do whenever you felt that arising?
Wow. Okay. And I tell you, your story thing really gets at the core, because this really gets at the core of where I'm at in it, because I think it had 3 levels to it. One was my burnout and recovery, then accompanying nurses and doctors who were burning out and maybe or recovering or not, and then the science of compassion piece. So the first thing was I learned it on my own, and I think the first thing that happened was I had to notice it, and my wife was very wise and supportive in that, and she said, I told her privately, like, I'm really hating my patients. And she goes, honey, you've got a problem, because the people who come to see you need you to love them. And so if you don't love them, they're not going to get better. And it wasn't a simple solution. So I think the first step was going, oh my gosh, this is not going well. And then admitting that to myself. And there's this wonderful thing in human life, that is labeled all kinds of different things, but it's a really wonderful mystery, very spiritual thing, that when we really embrace where we're hurting and we enter into it, there's a way that we can start noticing things that help us, and we start meeting people and seeing things, reading things, hearing things that help us find our way. And that's what happened to me. Once I was like looking for how do I get back, I started meeting people. That's where I met, Gene Watson, the, nurse theorist of Caring Science, and Tom Stella, and other great people who helped me kind of articulate what was going on. And then I started working with doctors, nurses, and therapists, and I'd see that they were going through this too, and that burnout actually could be a starting point. It couldn't be an end point, but it could be it really can be where you go, okay, I screwed that up, and then you start over, and then you rearrange everything, and then you go, okay, and then you find your way in it. And then I only discovered science of compassion. Gene Watson with Caring Science was a huge help in all of that. And then in 2011, when I started reading the neuroscience piece, I started realizing why it makes sense scientifically. But the bottom line was, when I came back, so to speak, from the mountaintop, it wasn't like I was on ongoing Xanax. You know what I mean? Like, people think like, oh, he went and he refound his compassion, and he came back from the mountaintop, and he's just like super positive now. He's reframing everything. You know what I mean? That kind of person is actually very annoying.
And rare.
You know, but then I was
rare.
thinking about, and but you know, and then I was thinking about it, like, well, that, you know, like, let's say I was on high dose Xanax, you know, working with people who are suffering. Well, I would be useless. You know, like, people would be going through things, and I'd be going like, oh, just chill. Oh, don't worry about it. Or, you know, I'd be like not engaged at all. What I found was that when I recovered it, I still was complaining about the negative things, you know, like the crazy healthcare system, negative patients, mean people, or terrible suffering. I still felt those things. But the other part was on fire, you know, so I was like going, you know what? I know how to do some things. This is what I'm due. And for as long as I can, I'm going to do this. And when I can't do this anymore, I'm going to do something else. But all of a sudden, it was like, you know what? We all go through things, and it goes a lot better when we hang in with each other. We're a lot more happy about this, about life. It's much more fulfilling. And, you know, and that's where I was on fire again. You know, it's just like, you know what? This is hard on everybody and everyone. And, you know what? I know how to do this. This is what I do, you know, and everybody's got a role. Everybody does something. You know, like the people who were making masks at the beginning of COVID, you know, or doing these special, whatever role we have, whatever we can do, we do it. And it's like, yeah, life is really hard. It goes a lot better when we rely on each other. And that's what I'd say, that was the theme of what my recovery was like. And what I discovered in the neuroscience of it is our brain actually works that way. That when you help another human being, your brain will mirror, it will register the pain that they're going through, almost like you are going through it. Your pain network is lighting up just like their pain network, your mirror neurons. But the other thing that's going on is that whenever we really help another human being, like genuinely, not where like I'm going to help you in order to feel good, it doesn't work in that case. But when we go, you know what, you're going through something and I want to be there with you, there's a network in the brain that lights up. It's the compassion network. And that's the cool thing. And I couldn't explain why I recovered until 2011. But now I can look back and say why being re-engaged with compassion actually helped me get back in gear again.
So anyway,
that's
thank you such an enlightening piece, and I want to reiterate what you just said there. There is a compassionate network in our brains, right? There is a compassionate network in our brains. This is not fluff. This is not nice to have.
Yep.
This is hard science. And if you want to know more about this, please check out Dr. Vachon's book, How Doctors Care, to talk about this compassion science. This is such a groundbreaking and beautiful and oh so needed part of healthcare today.
Well, Marcus, if I can return it back to you, you know, your work in narrative medicine, like stories, you know, a lot of times people will listen to a story and they'll go, oh, that's a really nice story, you know, or whatever. But stories are storehouses. All the wisdom is in the story. So, like, for example, when my brother went through what he went through, when I went through my burnout, when you went through what you went through, when you really look at all the details of a story, all the wisdom is there. And what I've really discovered with the hard science of compassion is that these stories have all the wisdom right in there. And so it's this wonderful mystery that like a lot of times people think stories aren't very scientific. What I've discovered is that the stories have everything in them. And then when I do research on them and I study them and read other people's research, I'm like going, oh my gosh, the wisdom was already there in the story. And the science helps us see and hear and feel the wisdom in the story. So I just want to say to you that I think sometimes people think narrative medicine. I just want to say, and this is where it's so cool I get to work with you, is that the stories aren't fluff either. The stories have all the wisdom right there. All the ingredients are right there. And they, like I said, they're storehouses. They're full of scientific information. And that way we get away from this, okay, it's a story now, that's entertainment, so to speak. You know what I mean? It's like, no, the story, like your story, is in our minds. When I work with people and I'm thinking of the people who were there with you, that's in my heart and in my mind. So when I'm accompanying somebody else, your story is helping my brain light up and get networked in the compassion mental state. But your story is inside me and it helps my brain be in the compassionate frame of mind.
The storytelling is therapeutic for the person who has gone through the story. And I say gone through as in trauma. But it's not just the story. It's not just the storytelling that's therapeutic. It's also the education that we learn from listening to the stories of others, right? Our compassion and our ability to empathize and to relate to other human beings. Our humanity is so received when we hear about the experiences of other people.
Yes.
And I want to thank you so much for sharing your experiences. I feel like we could talk all day, and I know we have talked for many long afternoons and evenings about these very subjects. But in the time we have left, I'd love to be able to shoot a couple of rapid fire questions past you, if you would.
Oh my God.
All right, and not even necessarily necessarily compassion science related. But we talked about stories, and so I'm wondering if you were stranded on the proverbial desert island and you had the ability to keep one piece of art with you, and whether that piece of art is a book, it's a Netflix series, it's a dramatic production, it's a piece of visual art or sculpture, what piece of art is a big part of your life, or an important, or even just a love?
Oh my gosh, Marcus, I'm going to have great answers for you later today. But art, that is not where I thought you were going to go with that.
And it can be a book. That's certainly a piece of art, yeah.
Well, no, I want to go with your art. It's much more. Okay, so here, the first thing that's in my head is music, and so I love this Respighi's Ancient Airs and Dances. I just find that really moves me, thinking about life in general. That would be one thing I would take. I think I would take music, and that would be. One of the
and
ones
this is a great opportunity to say that you yourself are a musician, and your primary instrument is
the bagpipe. Thank you for calling it. Thank you for calling me a musician. I play bagpipes. It is my hobby. I've done it since 1980, and if I could, that would be if I'd bring something. If you restricted what I'd bring, I'd certainly want fire and warmth, and but I think I'd bring my bagpipes and my drum too. I like drums. I like djembes and barons. So music would be to me a big part of
and so
what I'd want.
If we're watching Notre Dame football games in the fall, will we see you as one of the bagpipers on the field? No, we won't.
No, you won't. We are the pregame show. We march the players into the stadium, and then we're sent off. But our job is pregame. So we play in front of the Golden Dome. We We do where the tailgaters are, but our big thing is marching the players into the stadium. So that's what a bagpipe is for. A bagpipe is to process people in. That's
Well,
what we
let me
do.
process into another question then for you. How'd you like that segue?
No, that's good, man.
So let's
Good.
say that you opened up your wallet and there had been a $100 bill that magically appeared in your wallet, and you have to spend it, say, the next couple of hours, and you cannot spend it on another person. What do you buy with your $100?
I can't spend it
No,
on another
because
person.
every person that I know who's a clinician of any sort says, "Oh,
Yeah.
I would go spend it on my friends. I would go buy coffee for my fellow nurses or my fellow docs." So, what would
Yeah.
you spend it on for you?
Well, what I spend on is okay, books and music. Bam. I mean, that's where most of my entertainment money goes. But $100. Uh, there is this Indian drum I would really like. I think I would go. It's a drum. It's called a dal from India, and I don't need another drum. But if I just had $100 and it was just like I could just go with it, I, that would be frivolous. I would be like I'm going
That's
out to get
cool, and,
that
and
drum.
I think this is a perfect time to share that drumming has always been an ancient spiritual practice, and whenever
Yes.
we know that whenever we connect deeper with our spirituality, it also usually relates to a more compassionate presence, and so I love that you're a drummer and a bagpiper.
Well, I actually, and Marcus, this is part of one of the reasons I wanted to work with you, because of your, uh, your, how you make the story the central part of how to help us grow and keep going. Um, there are people like, there's a mythologist named Michael Meade and Robert Bly, but Michael Meade, I learned how to, watching him, he tells stories while drumming, and that's what really brought me into the power and importance of story. That when you share a story, other people are listening to that story, and a detail is grabbing them in that story, and it's pulling them into the story, and the wisdom of the story kind of works on them. So Marcus, because I get to work with you, I've heard your story now many times, and every time I listen to your story, another detail grabs me and pulls me in. And when a story no longer is teaching, that's when a story dies. And your story is so deep and powerful that every time, and I'm sure there are people who are listening to your podcast who feel this way, that they listen to your story or they read your book over again or they remember it, and the details of that pull them in. And I mean, this is where it pulls us into the compassion mindset. We need stories to help us find the balance, and that's what we hear. Like we hear people who were with you, and we're like going, "I want to be just like that person," or "That person can do it," and they didn't lose it. They were right there with you, and like Jenny and Barb, for example. So anyway, I just took off with that drum thing because I just really wanted to. I just want people to know the value of story, and that it's like not to trivialize it. It really is, scientifically speaking, what helps us find the balance. Because over time, you have all these stories that are in your heart, and you can remember the technical things, but these stories are shorthand ways of taking you there. And that's where why we wanted you to teach our students, because we know your story is going to keep teaching them years
And I
after
and I
they've met you.
hope that what I'm also doing is helping them connect to their stories, to what has
Yes,
inspired them
absolutely.
to want to dedicate their life to medicine or being a provider too. Um, I think everybody's story, when we really get right down to it, we all want to love and to be loved and to be valued and heard
Yes.
and held. And
Yep.
and if I can help connect these future clinicians to their stories and to the stories that they want to tell about their lives, that's what I'm here to do. And so, for my last question, if you had the world's largest billboard on the world's highest mountain, what is your message to humanity?
Oh, we're built for compassion. We are built
Human
for
beings, we are
compassion.
built for compassion.
We are built for compassion. If we violate that, we violate our true nature. Our true nature is being compassionate. That's what we were built for. People have misread Darwin, as you know. People always say Darwin said survival of the fittest, and it isn't. And actually, Dacre Keltner is the one who modified this a little bit and said it's survival of the kindest. We, we really we really were built to care for each other, and when we don't do that, we violate our human nature, and we are not going to be happy. If we aren't compassionate, we will not be happy. And that's not just a poetic or a moral ethic. That is literally how we were built. We are only surviving as human beings because we care for each other. That's the only reason. So now I'll look for a better way to put that on the billboard, but I'd start with be compassionate. Or no, I guess I'd say we are built for compassion. If you aren't compassionate, you're definitely not going to be happy, and we aren't going to survive as a human race.
And that's what we're trying to do, right? Not just survive as a human race, but
That's
to
it.
thrive
Yep.
and to be there for one another. So, well, Dr. Vachon, thank you so much for joining me today. We're going to put
Marcus,
some
thank you.
links to the Ruth Hillebrand Center for Compassionate Care in Medicine. If people want to check out your
Thank you.
book, which I am going to highly encourage them to do, you might need to set aside a couple of weeks for it, because how many pages is the book?
The book is
600
600
pages.
pages. It's a short book. You don't have to. You read the whole thing. You can. There's a part for businesses. There's a part on spirituality and philosophy of life. There's a part on practical aspects, part on attitudes, and there's a lot of it that's just like this wonderful science about it. And I've written it in a way that you can bop along in it. If you buy it, make sure you buy it from Cognella Press or me, because it's
Okay.
cheaper that way. Another bookseller whose name will not be mentioned is way overpriced. So buy it from Cognella or from me. I'm working on bringing it shorter. I'm working on a shorter version, and I have a 7-minute video now that I'm putting out next week. That's kind of the book in 7 minutes. So I'll make
Yes.
sure I give you that link. And I really thank you for letting me be on your podcast. And it's a real big honor to be with you. And it's one of the great gifts in my life that I
And
get to
I
work with
can
you,
I can say
Marcus.
the same
It's
thing.
wonderful.
Becoming a friend of yours and a colleague and a maybe even a contemporary, if I can give myself that much credit,
That
has been one
absolutely.
of the greatest joys of my life too. So, Dr. Vachon, thank you so much for being
Thank you.
with us today, and everyone, thank you for being part of this very special episode of the Compassion and Courage podcast. Remember that this is the podcast where we teach compassionate communication, provide perspective, and inspire resilience. Please remember to rate and review, subscribe, share, all those fun social media things. And we will see you all next time on the next CNC podcast.